The Chief Medical Officer's annual report published a strategy to reduce antimicrobial resistance. She expects stewardship to reduce the risks of inadequate, inappropriate, and ill effects of treatment. I have struggled to accept these scenarios since I first encountered the normal commensal in 1989. The cause of death that killed a healthy 14-year-old boy was staphylococcus aureus. This may sound like a Skifi B Science fiction film, but it's true. How can a bacteria living in and on us suddenly start killing healthy adults? We cannot succeed if we do not act now to stop the spread and continue without understanding the practical realities of managing infections. Antimicrobial resistance is a global 21st century public health crisis driven by the overuse of antimicrobials due to patient demand. We cannot blame doctors because the courts imposed punitive sanctions and awarded huge compensation to patients when patients developed secondary bacterial infections and died. The increased colonization of 12 microorganisms in hospitals makes treatment difficult. The number of infections due to multi-drug-resistant organisms is growing faster than we can invent a new antibiotic. What can we do when we are swamped with killer bugs? It is not a secret that humans are locked in our race. In recent years, the concept of a black swan, Nassim Nicholas Taleb's term for low probability but high impact events, has become widely known. Many have embraced the black swan. The threat of inadvertent pandemics is not a black swan because its probability is very high. Responsible governments and cooperative organizations have options, but even individuals can contribute something. As a medical doctor, I have tried my best to warn members of my profession and endured pain and suffering, only because I believe we can win this war and stop this elephant in the doctor's room. Only if we are honest with one another, work in harmony and integrity, and stop abusing antibiotics and also prescribing steroids. British institutes may have inflicted harm on doctors and destroyed their families to protect their institution from criticizing cruel, inhuman, or degrading, unethical medical practice or treatment. The health secretary claims to protect doctors who raise concerns about substandard care, but they seldom do. The physician must report a breach of the Geneva Convention to relevant authorities, but when they do, it will be them who become the victim. The physician is neither expected to use nor allowed to be used as far as they can with medical knowledge, skills, or health information specific to individuals. 30 doctors, investigated by the General Medical Council, have been investigated using false claims, complaints, and concealing the truth, have committed suicide. A physician working in hospitals or the community does not have complete clinical independence in deciding upon the care of a person for whom they are medically responsible. The physician's fundamental role is to alleviate the distress of his or her fellow human beings, and no motive, whether personal, collective, or political, shall prevail against this higher purpose. When the doctors report wrongdoings or unethical medical practice, the National Medical Council claims to have no power to intervene or support the physician and their family in the face of threats or reprisals resulting from a refusal to accept an inhuman or degrading treatment that inflicts pain and suffering on a fellow human. This callous attitude and disregard for declaration will now result in a pandemic that will challenge the healthcare profession, institutions, and humanity, whether prepared or not. We must deal with it when it happens. By a combination of massive inadvertence and what can only be called stupidity, we must now invent new and effective antibiotics faster than deadly bacteria evolve. Regrettably, they are rapidly doing so with our help. I do not exclude the possibility that bad actors might deliberately engineer deadly superbugs. But even if that does not happen, humanity faces an existential threat mainly of its own making in the absence of malign intentions. You have indeed been warned, and warned. The curse we have created was understood as a possibility from the very outset, when 70 years ago, Sir Alexander Fleming, the discoverer of penicillin, predicted antibiotic resistance. In 2015, in an article titled "The Most Predictable Disaster in the History of the Human Race," Bill Gates pointed out that one of the costliest disasters of the 20th century, worse even than World War I, was the Spanish flu pandemic of 1918-19. As the article's author, Ezra Klein, said, No one can say you weren't warned and warned. This pandemic of antibiotic-resistant and emerging infections will be the most predictable catastrophe in the history of the human race. Even with effective new medicines, if we can devise them, we must contain outbreaks of bacterial disease fast, lest they get out of control. In other words, we have a social organizational challenge and a strictly medical one. That means getting sufficient amounts of medicine into the right hands and in the right places. Still, it also means educating people and enabling them to communicate with each other to prevent any outbreak from spreading widely. 2006, I anticipated this and published a video in Medica 2006 warning healthcare professionals, pharmaceutical companies, device manufacturers, and healthcare providers that this would be a war we may never win. I did not anticipate the rapidity with which a minor bug, MRSA, could transfer information, knowledge, and technical know-how via plasmid to fungi, viruses, and parasites we cannot see and bring to our knees. I feel sad knowing our profession will unlikely continue to flourish, so I blame myself for not acting early to stop this elephant in the room. We helped MRSA create an army of microorganisms that surpasses our intelligence, a tiny living microorganism that has brought us to our knees. It has learned from us, adapted to us, and now exploits our genetic vulnerabilities with lethal precision. The antibiotic-resistant superbug has Manchester, London, Edinburgh, and Birmingham, but deaths are still not centrally recorded. Pharmaceutical companies, medical device manufacturers, people in power, and some doctors reject this elephant in the room. By not guarding the so-called miracle drug as custodians, we ignored using antibiotics to fatten chickens and treat animals. In the UK, the National Health Service, the health secretary licensed nurses trained in the classroom for 26 days with 14 days of mentored practice and 5 assignments, and community practitioner nurse prescribers who undergo less detailed training. Pulse obtained the figures under the Freedom of Information Act from the NHS Business Services Authority and compared them to May 2006 and May 2007. The newspaper found that prescriptions for the antibiotic ciprofloxacin were up 218%, the antidepressant paroxetine was up 262%, and the diabetes drug rosiglitazone was up 245%. Professor Hugh McGavock, a visiting professor of prescribing science at the University of Ulster and a former Committee on Safety of Medicines member, told Pulse he had serious concerns about the rule change. He said, "Nurses' knowledge of diagnosis is pathetically poor. It takes medical students 5 years to be competent to make a differential diagnosis. Only a country with insufficient doctors would go down this cheapy line. I am an independent nurse pharmacist, optometrist, physiotherapist, and podiatrist, therapeutic and chemist to sell without a prescription, resulting in a 49% increase in prescriptions. In doing all of those, we have lost an essential drug that helped us fight infections, make advances in medicine, perform surgical procedures, transplants, IVF, and save millions of people. It's become well known to many people. There's a general resistance to acknowledging the severity and imminence of the danger. A 4-month pregnant woman caught a urinary tract infection that was resistant to common antibiotics. The only option was to test an orphan drug, not knowing the outcome or effect on the unborn child. This drug was not tested on pregnant women before. The risks were unknown. While these cases are rare, reports of a highly resistant superbug are rising, and infection control doctors are worried. Carbapenem-resistant Enterobacteriaceae is not only difficult to pronounce, but deadly. These bugs live in the human gut, but can cause an infection if they enter the wrong place, like the urinary tract or a wound. Money has evolved to become immune to most antibiotics, so if someone becomes infected, only a few drugs will still work. These bugs are causing considerable problems in India, certain parts of Asia, the Middle East, and some southern European countries. However, no media or politicians dare discuss them because they fear destabilizing their systems. Until recently, most infections were seen in people who had traveled abroad and had family members who had or had been in a foreign hospital. The boom in cheap cosmetic surgery in India was blamed for a spate of infections in Britain. Now doctors are finding people who have never boarded a plane are carrying the bug. There have already been outbreaks in Manchester, London, Liverpool, Leeds, Edinburgh, Birmingham, Nottingham, Belfast, Dublin, and Limerick, among other areas. Patients with resistant bacterial infections must be treated inside hospital rooms so the bacteria do not spread and harm other vulnerable patients. However, single rooms are scarce in many of Britain's Victorian-built hospitals. The government doesn't centrally record deaths from superbugs, but hundreds are thought to have already died. Across the country, doctors are being forced to reach for older, more toxic drugs to treat the infections. The amount of colistin, called the last hope antibiotic, as it is one of few options still effective against CRE infections, rose dramatically in English hospitals between 2014 and 2015. I am sure more bacteria have become resistant to colistin, but we will hear about this as time passes. I did not expect doctors to use colistin because the drug was taken off the shelves soon after it was introduced. In high doses, this drug harmed the kidneys and nervous system, but was reintroduced when infections became immune to standard treatment. The more we use colistin, the more bacteria develop resistance to it. It's only a matter of time before it stops working too, leaving doctors' arsenal near empty regarding the most dangerous superbug infections.